Hello, my name is Janet Wise, and this is my son Justin. He's going to be my patient today, and this is my health assessment and physical exam video. So, Justin is 25 years old. He has no complaints today. Justin appears healthy. His color is good. His affect is pleasant. His speech is clear. He's alert and oriented times 3. And Justin, today we're going to do head to toe physical exam, and you're going to have me touching you and having you go through some tests today, and we're about ready to get started. Earlier, I checked Justin's vital signs, his blood pressure, his heart rate, his oxygen level, all within normal limits. So we're ready to start our physical exam. Justin, I'm going to start with your head. Okay, Justin's head looks very symmetrical. You're going to feel me touch your scalp and feeling for any abnormalities, which I feel none. Justin's hair is very healthy, scalp is symmetrical and round, and no lumps or bumps. Okay, and we'll just come on down and check sinuses. Do you have any tenderness here or here? No tenderness. Okay, good. And we'll just feel this temporal pulse. It's very strong. Okay, and open and grit your teeth. Good muscles there. Okay, so we're going to go ahead and move on now to Justin's neck. And just looking at his neck, his trachea is midline. No abnormalities, no lesions or anything noted. Justin, do you have any problems with your neck? Okay, we're going to go ahead and assess the lymph nodes. So we're going to feel under here and in the cervical. And I feel no abnormalities. Okay, can you shrug your shoulders? Good. Okay, push your head to the right against my hand and to the left and forward and back. Okay, good strength in the neck. And we're just going to try to get Justin to swallow and feel his thyroid. Can you swallow a couple of times for me? And again. Okay, and no tumors or any lumps, masses felt there. Okay, now we're just going to listen to his carotid. Okay, and the carotid sounds good. There's no whooshing sounds, no brewing. Okay, you turn your head to the right and to the left. Have good range of motion with his neck and good strength, and back and down. Okay, very good. All right, we're going to move on to the eyes now. So Justin, can you look up without moving your head and down and left and right? Okay, very good. Get my exam tool here. All right. Before we look in the eyes, we're going to check Justin's peripheral vision. Justin, when you see my fingers, say now, okay?
No.
Cover your
No.
left eye for me.
No. No.
Okay, cover the other eye.
No. No. No.
Okay, good. All right, so good peripheral vision. And we're just going to get our light and look straight ahead, Justin, okay? Just going to shine a light here. Okay, his pupils are equal and round, and they reactive to light. They react consensually as well. And we would have a Snellen chart normally in our physical exam to check his vision. Justin has always had great vision, not needed glasses or anything like that. So we're going to look in the eye now. And red reflex is apparent in both eyes. Okay, Justin, if you will follow this object without moving your head. Okay, and all 6 cardinal positions are good. So that completes our eye exam, and we're going to go on to the ears now. Let me grab my tools. So Justin, any problems with your ears at all? Okay, and no tenderness here. Ears are symmetrical, no swelling noted. So we're going to just look inside the ear. And the tympanic membrane, pearly gray. Oops, a little bit of wax in there. And tympanic membrane intact, pearly gray. Slight wax in there as well.
Get that out.
You could leave it for now. Okay, we're going to do some hearing tests with Justin at this time. The first test is a whisper test, so I'm going to get you to cover one ear and close your eyes. I'm going to whisper a test to you, and okay.
Mother. Baby.
Okay, cover the other ear.
Dog. Cat.
Okay, good. All right. Super hearing on the whisper test. So the other hearing tests that we're going to do are done with our tuning fork. And Justin, I'm going to put this on top of your head, and you let me know if you can hear that in both ears, okay? How do you hear that?
I hear it.
Both ears?
Both ears.
Okay, good. Bilateral hearing. Okay, now this is going to be the conduction test. So I'm going to place it on this bone. You say now when you stop hearing it, and then I'll place it in front, and you say now when you stop hearing that, okay? All right, ready?
Now. Now.
Good.
Now. Now.
Okay, good. So the Weber-Ryan tests are both show good hearing results. Okay, we're going to go on to the nose next. Let me get my light again. And we're going to look up into the nose first, and then we'll check for smelling. Okay, so just lift your head for me, Justin. Okay, Justin's membranes they're pink and moist. Don't see any obstructions whatsoever. Okay, Justin, if you will cover one nostril and breathe in and out, sniff. Now, okay, and the other side. Good. Okay, so clear on the sniff test. No obstructions noted. Okay. Justin, I want you to close your eyes, and I'm going to let you smell something and identify it for me, okay? Cover one nostril and smell. And what is that?
Pepper.
Exactly right. Okay. And let's cover the other nostril and close your eyes.
Garlic.
Very good. Nothing wrong with that smelling. Okay. So now we're going to move on to the mouth. Get my light, my tongue depressor. And we're going to look into the mouth. First, we'll look at Justin's lips are nice and pink and moist. Okay. We're going to look inside the mouth. Open your mouth. Open big. Okay. Membranes are red. Teeth are straight. Gums are pink. Healthy. All right, Justin, open your mouth. Say ah. Okay. Okay. So we have a positive gag reflex, and when he says ah, he has good uvula movement. I'm sorry. Okay. All right, so can you stick your tongue straight out for me? Very good. Okay. All righty. Let's do this again. Let's grit our teeth and let's have good muscles in the face are all positive. And we will do a smile and a frown and puff your cheeks out. Okay, good. So all cranial nerves are intact at this time. Okay, I think that completes our mouth exam, and we're going to get Justin to turn around and we're going to check out his posterior thorax. Okay, normally my patient would be exposed, and I will be able to assess the skin for lesions, look for symmetry, and look to see if the spine was straight. Everything would look good. We're going to roll your shoulders for me a couple of times, Justin. Okay, good. And we're going to just feel for symmetry, feel for any lumps or any abnormalities. Everything feels good, feels straight. Okay, say 99.
99.
Again.
99.
Again.
99.
Okay, and definitely louder up at the top. Okay, now we're going to percuss. Okay, Justin, let all your air out and deep breath in. And good expansion and good symmetry. Okay, we're going to listen now. Deep breaths. Couple more. Okay. And Justin has good bilateral breath sounds, no adventitious sounds noted. Okay. So we're going to have Justin turn back around. We're going to do the anterior thorax. Okay. And of course, my patient would normally be exposed, and I'll be able to again inspect the skin for any lesions or anything. I would note at that time the breast if there was any discharge or lack of symmetry in that area as well. And then we would palpate the chest, and everything feels good. Okay, and then we would percuss. Okay, and then we're going to listen. Okay, let's do 99.
99. 99. 99.
Okay, definitely louder up at the top. Okay, we're going to auscultate. Okay, Justin has good bilateral breath sounds. And of course, I can see that he's obviously not in any distress. His respirations are quiet and they're not labored. Okay, so at this time again, we would discuss self-breast exam and talk to the patient about doing this at home. That put your hands together like this and put over your head. When you do this at home in the mirror to make sure that everything is symmetrical and rise together. And then we would tell them how to palpate and the clock method, starting at 12 o'clock and using the pads of the fingers and going around. Justin, you want to try that? And around at 1 o'clock, 2 o'clock, and the clock. And the clock, okay. So that would be our breast exam so they can do at home. Alrighty. So we're going to go on to the circulatory system and the heart. And of course, looking at Justin, he doesn't look like he's in any distress. His trachea is midline. There's no jugular vein distension. So we're going to listen to his heart sounds real quick. Okay, yes, very strong heart sounds. I hear S1 and S2. S1 is definitely louder. So we're going to listen now for murmurs. And Justin has no history of murmurs, but we're going to check. And no murmurs heard. Okay, so that completes our cardiac check. And we're going to look at Justin's upper extremities and his arms. You can see they have really good color. They're warm and they're pink. Let's look at his capillary refill is very brisk, less than a second. And we're going to feel for pulses. Very strong. Okay, so very good circulation in the upper extremities. What is that?
Scratch it.
Okay, let's do some range of motion. Can you hold your arms straight out in front of you and curl your arms up, both of them? Okay, and back out. Okay, very good. And out to the side. And one hand reaching for the opposite shoulder behind your head. And then switch. Okay, so very good range of motion. Very good. You can relax. All right. At this time, we're going to have Justin lay down, and we're going to assess the abdomen. And I am going to pull the shirt up a little bit here. Okay. All right. So first, we would assess the skin, and I don't see any lesions or anything. Everything is the umbilicus is, midline. No problems at all with the skin. No distended belly. He's got no distension at all. So we're going to start right out by listening to the right lower quadrant first for bowel sounds. And of course, I would stay in each quadrant much longer in reality, but for the sake of the video, we're going to go shorter because bowel sounds we know can go every 5 to 30 seconds. We're going to listen for our pulsation and any bruit. Okay, don't hear any whooshing. All right, we're going to go ahead and percuss the abdomen as well. Okay, and we're going to palpate as well. Do you have any tenderness or pain? Okay, so no distension. The belly is soft and non-tender and warm. So we're going to try to feel in the spleen area and in the liver area. I'm sorry, I'm reaching in there deep. Okay. And for kidneys, when you laugh, I can't feel. Okay. All right, so abdomen appears well, listens well, palpates well, and at this time we would explain to our patient about a home exam for testicular cancer and how to examine himself in the shower, feeling for lumps or redness or tenderness, anything like that. He would report to his physician and follow up with. Okay, we're going to move on down to the legs. I hope you can see that in the camera. And Justin's legs, his skin, pink, warm, very appropriate. No lesions, some little boo-boos there. Capillary refill is good. He's warm. He's got good circulation to his lower extremities. Okay, so Justin, I'm going to have you do some tests for me here. I don't see any edema, anything like that. So some certainly healthy legs. We're going to listen to feel his pulses first. We'll start with the popliteal. And both are good. And we'll do the posterior tibial. Just relax. Okay, both bilaterally good. And we'll do the dorsalis pedis. And good bilateral pulses in the feet. All right, Justin, I want you to take your right leg and lift it straight up and put it down. And the left leg, that's very good. Good. And pull your knee to your belly. And the other, you're too young to groan. Okay. Flex both of your feet back and point forward. And relax your feet. And then just flex your toes back and squint your toes forward. Good. And let's do our heel to shin test. Place your opposite heel on the other leg and slide down. And on this leg now, switch. Okay, very good. All right, Justin, you can sit up. That completes our lower extremities. We're going to go on to some neurological testing. Justin, I'm going to be touching you with some items. Okay, this is just a cotton ball. So if you will close your eyes and just say now when you feel me touch you, okay?
No. 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 No.
Okay, very, very good. Okay, this is our sharp dull test. Okay, so you feel this on you. That will be our sharp, and this is going to be our dull. Okay, so you say sharp or dull, whatever you feel. Alrighty?
Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull.
Okay, very good. All right, you can open your eyes, and let's have your hands, Justin. I'm going to lift a finger up and down, and you're going to say up or down, whichever way you feel it. So close your eyes, okay?
Up. Down.
All right, very good. All righty, we're going to do the finger to nose test. So here's my finger. I want to take your finger and touch your nose, and then touch my finger, and back and forth rapidly. Good. Okay. And both hands on your thighs, and flip flop back and forth quicker. Very good. Very good. Okay. All right. Now I'm going to have you close your eyes. We're going to identify some items. Okay. So I'm going to hide these in my hands. All right. Open your hand for me. And you can use both hands if you want. And tell me what that item is.
Paperclip.
Very good. Okay. Keep your eyes closed. And what is that?
Keys.
Very good. Okay. And he identified those well. Okay, we're going to go ahead and go on to our deep tendon reflexes. Okay, so for the sake of time, I'm going to assess just one side and knowing that I would repeat on the other side. So Justin, we're going to start with our biceps tendon. Okay, just relax that arm for me. Okay, and then turn this and relax, let it dangle. Good, okay. And we'll do our radial. Just relax that arm, let me hold it. Good, that's a good reflex. And we're going to go to the patellar. Okay, and the Achilles. Good reflexes. And of course, and I would do that on the other side as well. Okay, we're going to do some range of motion exercises that involve walking. If you'll stand up, I'm going to swing this table out of the way. You are walking. Come back here for me. All right, if you'll walk towards the camera, heel to toe. Okay, and then turn around and walk back on your tiptoes. Turn around, walk back on your heels. Okay, good. And you can go ahead and stop. We're going to do our Romberg test and have you relax, feet together, arms dangle at your side, and close your eyes and be very still. All right, very good. Very good. Okay, we'll just turn a little bit sideways here. I'm going to have you lean over and check out your spine here. A little more. Okay, spine is straight. Cervical. Good. No step-offs. Very symmetrical. Okay, stand up straight. And we're just going to check your flexibility. Can you arch back a little bit, bend back? Okay, and stand up and bend to the right and to the left and twist to the right and twist to the left. Okay, very good. All right, as far as I know, this completes my assessment and my physical exam. And I want to thank Justin for helping me out here, and see you later.